My name is Faith Meyers, and I'm a current fourth-year medical student at Louisiana State University, New Orleans School of Medicine. I assisted in conducting this research with David Yang, a current second-year resident in Yale's emergency medicine program, who created this project. I will be presenting our study investigating length of stay for adults presenting with suicidal ideation in the emergency department and inpatient setting. I have nothing to disclose. Suicide is a leading cause of death in the United States that affects patients across many demographics. The CDC identified suicide as the 10th leading cause of death in the United States in 2017. Suicidal ideation is a common presentation in the ED, and visits related to SI continue to rise. In 2013, combined ED costs plus inpatient costs of those admitted to the hospital following an ED visit related to SI was approximately $2.2 billion. Prolonged boarding times are a major contributing factor to this, as it has been shown that mental health patients have disproportionately increased lengths of stay. This can have a detrimental impact on our mental health patients as well as other patients in the ED. Current literature has identified factors associated with increased length of stay in the ED for mental health patients in general. Such factors include insurance status, the need for transfer or admission, and the presence of suicidal ideation. The aim of this study is to investigate factors associated with increased length of stay in the ED and inpatient setting for patients presenting with suicidal ideation. We conducted a retrospective chart review of adult patients evaluated and treated at University Medical Center New Orleans Emergency Department, a large urban level 1 trauma center. Inclusion criteria were adults over the age of 18 who presented to the ED from August 2015 to September 2016 with a chief complaint of suicidal ideation or suicide attempt. Worth noting is that UMC contains a dedicated psychiatric ED, the Behavioral Health Emergency Room, which includes 26 beds separated from the main ED to provide rapid assessment, stabilization, and treatment of patients in psychiatric crises. Data collected from each patient included demographics, social history, medical history, length of stay in the ED, management, and immediate outcomes. Associations were evaluated between length of stay and potential covariates. We calculated rate ratios considering gender, race, living situation, insurance status, PCP use, amphetamine use, hallucinogen use, alcohol use, and number of ED visits as potential risk factors. 1,150 patients were included in the study. The average age was 39 years old. Approximately 61% of the patients were male. Approximately 51% of our patients identified as non-Hispanic Black, 45% identified as non-Hispanic White, and 4% identified as Hispanic, Vietnamese, or other. 68% of the patients reported alcohol use, and 8% reported amphetamine use. 31.6% of presenting patients were eventually admitted to the hospital. The graph on the left is outlining factors that affected length of stay in patients presenting to the ED, while the graph on the right is outlining factors that affected length of stay in admitted patients presenting to the ED. The y-axis on both shows the rate ratio for each of the compared factors on the x-axis. Our study found that patients who identified as non-Hispanic Black had increased length of stay compared to non-Hispanic White patients. Alcohol use increased length of stay, and older age decreased length of stay. For those that were admitted to the hospital, patients that identified as Hispanic, Vietnamese, or other had increased length of stay compared to non-Hispanic White patients. Alcohol use and amphetamine use were also associated with decreased length of stay in admitted patients. There are some limitations to our study. This study is limited by the fact that it only includes patients presenting to a single ED at University Medical Center in downtown New Orleans. The study also relied on ICD coding to identify patients with a chief complaint of suicidal ideation or suicide attempt, which overlooked patients presenting with a different chief complaint that later endorsed SI or SA in the same visit. As noted before, the ED at University Medical Center in New Orleans has a behavioral health observation unit that is dedicated to psychiatric patients. While a study in this setting does allow for a better understanding of the factors that influence length of stay in an ED with a separate dedicated psychiatric service, the results may not be directly applicable to other urban EDs with a more traditional layout. This study identified multiple factors that affect length of stay in the ED and inpatient setting. Non-Hispanic Black patients and patients with alcohol use were identified as predictors of increased length of stay in the ED. Older age correlated with decreased length of stay in the ED. For admitted patients, patients identifying as Hispanic, Vietnamese, or other correlated with increased length of stay, and alcohol and amphetamine use correlated with decreased length of stay. With the recommendation for and rising implementation of dedicated psychiatric observation units, it is critical to assess the various ways they may affect patient care. These findings show continued evidence of disparities in the ED and inpatient care in this setting. Continued studies addressing length of stay in patients presenting with SI to EDs without dedicated psychiatric units may prove beneficial. Uncovering these disparities across different ED settings will allow us to target them with the goal of improving quality of patient care and decreasing overall utilization of the ED's resources. Thank you for your time.